Hey y'all, it's Ryan, and today I'm going to tell you about a study from our lab about how childhood adversity affects mental health after the death of a spouse. This work is really interesting because it highlights the impact that childhood maltreatment has on the way we react to stressors later in life. So let's start by defining childhood maltreatment.
Childhood maltreatment is defined by the World Health Organization as any abuse or neglect that occurs to children under the age of 18. Childhood maltreatment encompasses all types of physical, mental, and emotional abuse, in addition to physical and emotional negligence and neglect. Childhood maltreatment was first studied in the 1990s as a component of what has become known as adverse childhood experiences. Childhood maltreatment and other adverse childhood experiences, like living with someone who has a mental illness or the incarceration of a family member in the household, all have the potential to impact health and wellness across the lifespan. While there are many factors involved in childhood maltreatment, this study focuses on physical abuse, mental abuse, emotional abuse, and physical and emotional neglect.
Thanks for those definitions, Megan. So for a little more background, there's strong evidence that links childhood abuse and neglect to negative mental health outcomes later in life, including depression, anxiety disorders, and PTSD. What's fascinating is that in addition to increasing risk for mental health conditions, a history of childhood abuse is also associated with an increased risk for cardiovascular disease, type 2 diabetes, and cancer. And this is probably because childhood maltreatment dysregulates the body's typical responses to stress, leading to a heightened stress sensitivity in adulthood. Now, losing a spouse is a huge stressor, right? So it's really important and informative to investigate how stressors in early childhood continue to impact psychological and physiological responses to stressful life events throughout the lifespan. So this study investigated if people with a history of child maltreatment experience more depressive symptoms than people without a history of childhood maltreatment. And importantly, if being bereaved actually interacts with childhood maltreatment to cause those with both a history of child maltreatment and who have recently experienced that loss of their spouse, right, to experience the highest level of depressive symptoms. So in this study, our lab had 44 people who had recently lost their spouse, about 89 days earlier on average, and 44 control participants who were not bereaved come into the lab. All the participants self-reported their history of childhood abuse and neglect, the depressive symptoms they were experiencing, and some demographic information as well. So when Michelle and Megan compared the depressive symptoms between participants, what they found was regardless of whether or not people were spousally bereaved, childhood maltreatment not only directly impacted depression levels, but it also interacted with the stress of losing a spouse. So people with a history of childhood maltreatment had more symptoms of depression if they were bereaved compared to if they were not bereaved. That means that experiencing bereavement, a highly stressful life event, made the elevated level of depression among those with a history of child abuse even more apparent. So what does all of this tell us about the ways that child abuse continues to impact mental health in adulthood? The kindling hypothesis suggests that early childhood adversity makes people more vulnerable to poor mental health by lowering their threshold for event-related distress. And that's exactly what these results point to. When there's a significant life stressor like bereavement, those with a history of childhood maltreatment are more sensitive to the stressor that makes the impact on their mental health more pronounced. So this research is so interesting because it highlights the extent of damage that childhood maltreatment can have on a person and calls for more preventive resources. These results also point out the importance for healthcare professionals to know their patients' abuse history and to devote attention to recent life stressors like a loss, especially among people with a history of abuse or neglect.
So in summary, we found evidence to support that childhood abuse and neglect led to negative health outcomes later in life. We demonstrated this by looking at how childhood maltreatment impacted depressive symptoms among an older adult population and found that people who had experienced childhood maltreatment had higher depressive symptoms than those who did not experience childhood maltreatment, even decades after experiencing the abuse and neglect. We also showed that people who experienced childhood maltreatment had even more symptoms of depression if they recently lost a spouse compared to our control participants who did not recently lose a spouse. This highlights that it's super important to understand the long-term impacts that childhood adversity can have when experiencing a stressful event later in life.
Thanks for that summary, Michelle. If you're interested in this work, you should definitely be following Michelle Chen. She is doing a lot more on how childhood maltreatment and early life stress can affect our responses following stressors later in life, and she will be doing incredible work, so definitely follow her. There's still a lot to explore about the interaction of childhood maltreatment with bereavement and other life stressors, including its impact on physiological responses during and following stress. But the findings in this paper are a great call to action for more attention to understanding how early life stressors continue to impact people in life. All right, y'all, that's all for today. Thanks for stopping by, and please click like or subscribe for more content like this.